My name is Dina Anderson. The presentation describes my capstone project I completed for my master's in nursing informatics. The project I chose is leading a successful training program in preparation of an electronic health record upgrade. The reason I chose this project is because due to the 2009 American Recovery and Reinvestment Act, ARRA, which was passed to inject a significant amount of money back into the economy to create jobs, provide recession relief, and stabilize the government budget. As a result, the Health Information Technology for Economic and Clinical Health Act, HITECH Act, was enacted implementing EHRs into hospital systems. The HITECH Act created an initiative for a nationally integrated database, and the Centers of Medicare and Medicaid Services, otherwise known as CMS, was authorized to provide financial incentives to meet new meaningful use requirements so that money was injected back into that economy. Though computers had been in existence for over 30 years, hospitals were not utilizing their systems. 11 years later, hospitals are still challenged with educating their staff as EHR vendors update system functionality due to regulatory requirements and/or new technological solutions that enhances the product. Workflows also change due to new functionality, regulatory requirements, and evidence-based practice. I work at the corporate office of a hospital enterprise of 87 hospitals that are in 30 states across the United States. 24 of our hospitals are on a platform that is getting ready to take a system upgrade that impacts providers, nurses, pharmacy, and lab. The training program consisted of training the local clinical informaticists, CIs, and prepare them so that they could train their staff. We used a train-the-train methodology since the facilities are scattered all over the country and we needed to provide remote education to the facilities. Our team took the vendor's summary of enhancement and release notes, tested the system, developed educational materials for the facilities, and held 2 teleconferences to go through the changes that would impact the users. The team chosen to design and develop the training program was comprised of nurses, medication management, and ancillary staff. The training was geared towards the local CIs to prepare them with the knowledge and tools they needed to train their staff. The local CIs are also responsible for understanding full system functionality to better support the business needs of the electronic health record. During this presentation, I will be discussing the project implementation, evaluation of the outcomes, and the analysis of the project and closing statements. Enhancements in technology creates a revolution in the tools that clinicians are used to using, which results in human changes to the system technology or the processes they are used to following. Kurt Lewin's change theory focuses on the change process in human systems. For humans to change, they must unlearn without loss of ego, identity, and relearn by restructuring one's attitudes, thoughts, and feelings. Skine discussed how change is hard on everyone, and many get frustrated when they are taken out of their comfort zone and engaged in a different direction. The training team was asked to create a new program to train the facilities of the new enhancements in EHR. Many teams have been training the facilities for years on new functionality enhancements, content, and workflow changes. Each training session led to feedback that the training was just not enough, didn't provide enough information so the local facilities were comfortable training their staff, and the end users suffered and resisted the changes, decreasing productivity and satisfaction that ultimately impacted patient care and outcomes. Change management was put into action, demonstrating communication between the team members that were creating the training program, sharing knowledge of what has worked, what hasn't worked in the past, how the changes would impact not only the end users, but also the CIs who are responsible for training the staff. Leadership provided clear objectives and deadlines. Professionalism was used to communicate feedback in a constructive manner, so requested changes to individuals' output was not taken personally. Business skills pulled at the different ideas and tools that were used together to create a successful training program. Change management was used as it related to processes, tools, and techniques to manage the team to create the successful product. The local CIs are also responsible for understanding full system functionality to better support the business needs of the electronic health record. CIs are the clinical experts in health technology, and they oversee not only the functionality of the system they support, but the processes or workflows that are put into place to ensure systems are used with quality and safety in mind that drives positive patient outcomes. The objective of this project was to provide a solid train-the-trainer program for the local clinical informaticists or educators so they can successfully train their staff on the new functionality, giving enough time to train, the right tools to train the staff, and monitor the success of the upgrade. Adult learning techniques were used to develop the training program. The tools created consisted of a PowerPoint, short 1 to 2 minute videos with competency questions after each session, and tips and tricks. Finally, I will discuss the effectiveness of the program. For written learners, a detailed PowerPoint was developed with detailed instructions and screenshots. This tool was geared towards the local clinical informaticists. For the visual learners, short 1 to 2 minute videos were developed to show the workflow and system functionality changes. The computer-based training will be added to each affected employee's health stream, which is our enterprise learning module that assigns mandatory training. Competency questions after each session was used to check learner engagement and understanding. For the just-in-time learners, one-page tips and tricks for each enhancement was designed to take with them after training, to put on the hospital intranet for reference and/or to have at the nursing stations for easy access of new information. 2 training sessions were provided where the tools were shared. The CIs watched the videos and participated in the poll questions, and a survey was sent to get feedback on the success of the training methodology used. Outcomes of the effectiveness of the training project was based on the interprofessionals team of providing a solid professional demonstration, including developing team training materials and meeting organizational deadlines so the upgrade could be implemented on time. A survey was used to measure the CI's experience in partaking in the training program. Some of the questions on the survey asked questions of satisfaction of the education and format of the training given. Other questions weighed on the CI's comfort level in being able to use the training materials to train their own staff. The survey results will be used to make modifications for future training programs and implementing policies to other EHR teams to make policies on disseminating information about platform upgrades to their users. The survey results will also be used to choose the most appropriate tools or adapt the tools to fit the needs of the facility to better prepare them to train their staff for optimal adoption of the new technology. Some of the CIs included their pharmacy staff to participate in the training so the pharmacy folks would be better equipped to assist providers if they had questions on functionality that is medication related. Thus, we ended up with 29 responses from 24 facilities. A scale of 1 to 5 was used, with 1 being don't use this again to 5 being this method is excellent. We got 90% that responded that we had a good to excellent method for the training program. 72% rated the demonstration as very relevant, while 28% responded they felt the material was extremely relevant to demonstrating new functionality and workflows. During the first presentation, the computer-based training sessions were blurry and there was technology issues due to the number of individuals being on the teleconference. Given the challenge faced, 38% reported the presentation was extremely clear, while 52% stated the presentation was very clear. The remaining 10% rated the clearness of the presentation as not at all clear and somewhat clear. 86% felt that the education that was provided was about the right amount, while the other 14% scored the information presented was either too much or too little for them to be successful. 31% of the participants felt the instructors were engaging, while 62% scored the instructors as very engaging during the presentation. One of the challenges of online training session is that there is a lack of face-to-face, and the end users are in an environment where they may be called away or must take a call from a provider. One of the ways the team tried to keep the CIs engaged is by asking poll questions about the material to gauge how the information provided was being absorbed. Overall, the facilities rated the training provided between very good at 48% and excellent at 38%. The team felt 86% was a success to the program that was created. 93% of the CIs rated their takeaways of what they needed to do between very clear and extremely clear. The methodology that was used was explained both in the beginning of the program and at the end, and how the CIs could use the tools, resulting in 90% either being very clear or extremely clear on how the training program and tools given were supposed to assist them. 90% responded that the speed of the presentation was the right amount. 90% of the participants responded that the materials that were developed were helpful for their understanding of the upcoming changes and their ability to train others. A required open-ended question about what improvements the team could make was asked to help with the design of future trainings. These are continued answers to what improvements can be made to the next training program. Additional feedback was asked to see if there was anything that attendees wanted to share about the training. Training is one of those intangible assets that enterprises need to determine their success. Knowledge management can improve results by either gaining the knowledge themselves or from external sources. Leadership has not placed enough value on having an education team at the corporate level, but the facilities rely on corporate to provide knowledge management using the technology that is in place with evidence-based practices. Leadership still has the mindset that the vendors can educate the facilities of the best practices of utilizing their systems. What the vendors cannot teach is the workflows or the standardized documentation that were put into place so that data collection can be extracted and drive further evidence-based practices. Nurse leaders use data collection to improve patient care. Value-driven measures of service, quality, and cost can help mandate changes in the workplace. The data is translated into information that transforms care, achieving excellence in patient care, and drives the competitive lead. Nurse leaders need to seek corporate commitment in driving change using data analysts and accessible data. Health informatics uses systems theory to look at larger integrated systems. Analyzing systems that are interrelated look at interdependencies between clinicians, organizational policies, financial impacts, and the clinical outcome of patients. Informatics uses decision-making logic to design, manage, and evaluate healthcare organizations to make the most cost-effective decisions that provide the best patient-centered care. The opportunity to lead a team of talented individuals in creating such an incredible project that got good responses from the local clinical informaticist was amazing. Healthcare Information Technology, HIT, has triggered a need for a new approach to training. The advanced degree program has helped broaden the knowledge of being able to assess training needs and recognize that although system functionality may seem intuitive, many providers lack computer skills and are challenged by the complex healthcare system. Learning to be the change agent to help the local facilities understand the complex applications that introduce new equipment, change processes, and workflows. Advanced education has provided the background and tools to lead a team and serve as a change agent for the hospitals being impacted by the vendor's update. Healthcare is no longer just about hands-on patient care. Healthcare has become the future of collecting data, synthesizing the data, and driving evidence-based practice that results in positive patient outcomes. I'd like to thank you for reviewing my capstone project for my master's in nursing informatics on leading a successful training program. I have included the references that I used as sources to create my project on leading a successful training program.